Deadly disease with symptoms that usually begin with sudden flu-like symptoms. You feel tired, you have fever, you feel weak, you have no appetite, you have muscular pain, joint pains, headaches, and a sore throat. Then you may start feeling nausea, you may start vomiting, and you may also get some diarrhea, and sometimes you may get some hiccups. You may wonder, what is this deadly disease? The disease is the Ebola virus. This is the Learning Academy. Like, comment, share, and subscribe. And today, our focus is on the Ebola story and the hope that springs from this story towards finding the cure for our current global virus. Ebola is commonly known as the Ebola virus disease or the Ebola hemorrhagic fever. This virus was first discovered in 1976 in Zaire, which is currently known as the Democratic Republic of the Congo, and the virus was found near the Ebola River. Case fatality rate for Ebola is basically 90%. That is what the World Health Organization states. Ebola is extremely contagious, and it is easily spread through bodily secretions and fluids, and is easily transmitted from one person to another. The Ebola outbreak started in 2014, and it continued until 2016. It was the largest outbreak since the virus was discovered. It became known as the West Africa Ebola Epidemic. It was widespread across West Africa. It was common in Guinea, Liberia, and Sierra Leone. It also affected Italy, Mali, Nigeria, Senegal, Spain. It even spread to the United Kingdom and the United States. Surprisingly, the virus is still around in 2020. And as of January 14, 2020, there was 3,406 confirmed and probable cases. 5 types of Ebola viruses, and 4 of them cause the disease in humans. The epidemic of 2014 to 2016 killed more than 11,000 people. However, the disease was stopped in its tracks. The virus is normally transmitted to persons who come in close contact with infected animals. These infected animals include chimpanzees, fruit bats, and forest antelopes. During the 2014 to 2016 epidemic, the RVSV-ZEBOV vaccine was in development. However, in 2018, when the disease reappeared, it was quickly deployed, and persons in the Democratic Republic of the Congo were vaccinated after approval was received from the government. This vaccine, however, was designed to be used against the Zaire strain of the Ebola virus. There are at least 15 vaccines that are being developed across North America, Europe, Russia, and China. However, there are only 4 main candidates that are currently in the advanced stages of human testing. They include the VSB-EBOV and the CHAD3-ZEBOV, as well as the AD26-ZEBOV and the MVA-EBOV, developed by Johnson & Johnson. Also, there is a vaccine that was developed by Novavax. Johnson & Johnson has developed 2 different vaccines for Ebola, AD26-ZEBOV and MVA-BN-Philo. The FDA gave approval to Merck & Company for their new Ebola vaccine. This happened in 2019. The name of the vaccine is Ervebo. Vaccines and treatments for the Ebola virus have been in development for almost 7 decades. However, between 2014 to 2019, the efforts and the work towards combating the outbreak has been accelerated, and many solutions have been found, and this has resulted in many lives being saved. One of the most promising vaccines is the RVSV-ZEBOV. It has 100% effectiveness against the Zaire species of the Ebola virus. One side of this vaccine is that it is not effective against 3 species of the Ebola virus. Besides Merck and Company and Johnson & Johnson, Regenerant is another biopharmaceutical company that is working on Ebola vaccines. Regenerant's vaccine is named REGN-EB3. This is an experimental biopharmaceutical treatment that is inclusive of 3 antibodies that were developed by Regenerant Pharmaceuticals to treat the Ebola virus disease.